Hello, my name is Nuala Hiesblink, and I am a physical therapist specializing in outpatient orthopedic and sports medicine. Today, I'll be talking about anatomy of the hip. The hip joint is made up of a ball and socket synovial joint formed between the femur and pelvis. The acetabulum is the socket in the pelvis formed by three innominate bones, the ilium, the ischium, and the pubis. The acetabulum faces laterally and also slightly inferiorly and anteriorly. It is a round, cup-shaped structure where the femur articulates. At the top of the femur is a rounded protrusion called the femoral head, which articulates with the acetabulum. Both the femoral head and the acetabulum are covered by articular cartilage, a smooth, white tissue that covers the bones, allowing frictionless gliding to occur. The labrum is a fibrocartilaginous rim attached to the margin of the acetabulum. It is horseshoe-shaped, and the ends are connected at the acetabular notch via the transverse ligament to form a complete circle. The labrum deepens the acetabular cavity to enhance joint stability. The labrum also creates a seal that helps keep synovial fluid within the articular cartilage, preventing direct contact between the femoral head and the acetabulum. The labrum is wider and thinner in the anterior region of the acetabulum and thicker in the posterior region. There are several ligaments that connect the femoral head to the acetabulum to help provide further stability to the hip joint and restrict the joint from going into extreme positions. The most notable ligaments in the hip joint are the iliofemoral ligament, the pubofemoral ligament, the ischiofemoral ligament, and the ligamentum teres. The iliofemoral ligament is the strongest hip ligament and connects the pelvis to the femur at the front of the joint. This ligament is Y-shaped and often referred to as the Y ligament of Bigelow. It attaches to the anterior-inferior iliac spine and the lower part of the intertrochanteric line. It prevents hyperextension of the hip joint during standing by holding the femoral head within the acetabulum. The ischiofemoral ligament reinforces the capsule posteriorly. It originates on the ischial part of the acetabular rim and spirals superolaterally to the neck of the femur. This ligament also prevents hyperextension and holds the femoral head within the acetabulum. The pubofemoral ligament is attached to the obturator crest and the superior ramus of the pubis and blends with the joint capsule. The pubofemoral ligament reinforces the capsule anteriorly and inferiorly and prevents overabduction of the hip joint. Now let's talk about the musculature of the hip. There are 22 muscles acting on the hip that contribute both to the stability and mobility at the hip. The musculature can be broken down into 4 quadrants: anterior, posterior, medial, and lateral. The anterior quadrant consists of the hip flexors. The iliopsoas, made up of the iliacus and psoas, is the primary flexor of the hip. The rectus femoris and sartorius also contribute to hip flexion. The posterior quadrant consists of the hip extensors. The primary extensor is the gluteus maximus. In addition, the hamstring also works to extend the hip. The medial quadrant consists of the adductor group. These are 5 muscles that include the adductor longus, adductor brevis, adductor magnus, pectineus, and gracilis. The lateral quadrant consists of the abductor muscles. The primary muscles that abduct the hip are the gluteus medius and the gluteus minimus. In addition, the tensor fasciae lata and gluteus maximus contribute to hip abduction. Deep in the lateral and posterior quadrants are 6 muscles that externally rotate the hip. These consist of the piriformis, obturator internus and externus, gemellus superior and inferior, and the quadratus femoris. There is no muscle that acts to primarily internally rotate the hip. The 2 muscles that contribute to the action of internal rotation are the anterior portion of the gluteus medius and the tensor fasciae lata. That brings us to the end of the discussion. Thank you for joining us today.